Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Geoff. I'm sorry, I didn't ask you if you pronounce your name Michaelis or Michaelis.
Everybody in my family pronounces it differently, but I like to go with Michaelis, but any day, anything's fun.
Okay, Michaelis, thank you. And Geoff Smith. That's easier.
Yes, it is.
So thanks for
Hello,
joining.
Jeff.
Yeah, so
Hi.
thanks for joining us today, Dr. Geoff and Geoff.
Yes.
Okay.
Glad to be here.
Okay, great. So by way of introduction, Geoff Smith and I initially connected on a healthcare reinvention collaborative Zoom in a breakout room. And Geoff then reached out to me suggesting we have a conversation as our purpose is very much aligned. And we had a great talk, and Geoff shared a wonderful story about the importance of human connection in healthcare, which you might share today. And Geoff says that employee engagement is often just a buzzword, but in healthcare, it's a necessity for optimal patient outcomes. And I fully agree with that. And Geoff supports entrepreneurs, and he brings hospital executives, administrators, caregivers, and team leaders together to engage the most critical workforce on the planet. I love the way you say that. And I've also connected you with Dr. Simon Craig. And if you want to speak to that at all in your collaborations or interactions, that would be fine. And Dr. Geoff and I officially connected on LinkedIn back in October, though we didn't communicate until recently when Geoff tagged me in a message announcing his new podcast, Justice in Scrubs, which he records with attorney Richard Hastings. And they delve into the fascinating world of legal and medical matters, from groundbreaking court cases to cutting-edge medical breakthroughs. That sounded quite interesting. And on speaking with Geoff, I discovered another interesting fact that most of my doctors is your practice was in this area. And I was so excited to learn that. And when I said their names, you were like, those are great doctors. And I said, I know that. So here's a shout out to all my amazing physicians. And I connected you with Dr. Tada. And so if you guys have already had a Zoom and if you want to, speak to that, because one thing we talk about is an impact network and deep and wide connections, and how we've connected, then, we've connected, and it just, expands. And that's so critically important and amazing and interesting. So today we'll be talking about each of your current perspectives on supporting physician engagement and physician well-being. And so it's interesting that all three of us live in Connecticut, and we've all been involved with the same healthcare system in some capacities over time. So I'm sure we'll find a lot of synergy here. So I usually start by asking what you'd most like our audience to know about you. Dr. Geoff, would you like to go first?
Sure. First of all, I want to thank Kim for doing an amazing job of connecting people and sort of explaining how important patient-doctor relationships are, and how everything in our field is really personable. And if we're not a computer, and we take a lot of information from the patients from nonverbal cues, and also getting to know the patients over many years. Sometimes we can just look at the patient and know what's wrong with them. So it's a very personal field, and I think that's a great thing that you have helped us helped get the word out of how important it is for that. So personally, I went into practice in 1986. A while ago. We had no computers, no fax machines, no printers. We had a digital phone that you push the button, and we had an overhead intercom system. And that's how we started. Our notes were handwritten, they were very short, and they really centered around the medications, which is still the most important thing, is the medication list. And we had 3 doctors and 5 employees. When I left practice, when I retired a couple of years ago, we had 3 doctors and 15 employees. We had 20 printers, I think, and we had a computer system that we did everything with. And we didn't have any fax machines because fax machines are passé now. but life was totally different. We were in private practice in 1986, and about 2000, 2001, we sold our practice to the hospital because we couldn't afford having a computer system. We couldn't afford all the compliance issues that we needed to do, the OSHA regulations and this regulation and that regulation. We didn't have the expertise to handle that. And for us to obtain that expertise, it would be too expensive for a small practice. So we sold our practice to the hospital. Then at that time, there was just one hospital system. Now the system is about 13 hospitals, and it was just recently acquired. It's going to be well over 100 hospitals and probably thousands of doctors across 2 states. Yeah, across 2 states. So it went from my little practice to a huge system. And what happens is when you have a huge system is you lose a lot of autonomy. And you get right. So the interests change. We're told to do things that we're told to do things that we don't always like to do, or things best for the patients, and there's a lot of friction between the doctors and the bureaucrats. Now, in 2016, I joined the electronic medical record team, and my job was really to focus on customization and teaching. So I met with doctor groups every single day. And what was most amazing was the pain that I saw in the doctor's eyes. This computer system was really horrible. They became, instead of doing data analysis, they were doing data entry. One doctor told me that the only change that the computer system does is things that my nurses and my staff used to do, I now have to do, which is horrible. The documentation requirements have exploded. Doctors are now seeing patients maybe 8 hours a day and going home, having dinner, and spending 3 hours on the computer. They call this pajama time. Typical pajama time is at least 20% of your practice. Some doctors are going up to like 30 or 40% of their practice time. They do pajama time. When I went towards the end of my career, I went back to my office because my partner called me, and one of our partners left, and we were hiring somebody. There was like a 3-month gap. So my partner called me back, and he said that I needed to come back, and I came back. So I ended up the last 3 or 4 months of my career back in primary care. I was getting up at 4 o'clock or 5 o'clock in the morning to do my notes before I saw the patient, because I didn't like to bring the computer into the room because the computer was a distraction. So I wanted to look at the patient and actually talk to the patient. So I did not bring the computer in. Because I didn't bring the computer in, I needed to do my data gathering and my note taking, the outline of the note before the morning. So I would get up at 5 o'clock in the morning or 4:30 in the morning, spend 2 hours on the computer before I would see the patient. All my notes were pretty much done. I just had to bring in the details. And then I was really pretty much done at 5 o'clock. But it allowed me to really see the patient and the way it's supposed to be. Because if you bring the computer in the room, it's a distraction. And you end up looking at the computer instead of the patient, which is really not the way you take care of patients. Sometimes I needed to see the computer, so I bring the patient into my room, my office, and then I would show them like x-rays or whatever I needed to do. But I never brought the computer in the room with me. So it's just, the documentation is taking much of our time instead of actually taking care of patients. So that when I was doing the EMR, it was amazing how much pain the doctors were feeling. And now with people like Kim and other people, they're starting to see doctors are coming together and leaving these large medical groups and starting their practice. And there's a lot of support out there, and I think it's amazing. And I think people like Kim and Geoff, you guys are really helping the doctors and telling the patients to really understand what's really going on. And we really need a support system out there for people like you guys to help us get control, right? Get a control and understand that the patient-doctor relationship is everything. And the bureaucrats or the computer is really putting a barrier between us. And we need to reestablish what's important, and it's the patient-doctor relationship.
Well, thank you for painting that very accurate and vivid picture. I think that sums it up very, very well. And Geoff, what would you like us to know about you?
Well, I have a pretty diverse 25+ year career in human capital management, primarily employee engagement, employee experience, leadership development, culture change initiatives in the workplace. And for the last 10 years, I've focused 100% on healthcare. So doing everything from helping hospital administrators engage and appreciate their caregivers to helping nurse and doctor entrepreneurs launch their amazing products and idea to the market to make a true impact on those that both provide and receive care.
Yeah, well, that's fantastic. And so Dr. Geoff, when you did speak with Dr. Todd Otten, right? Have you had a conversation yet?
I don't know. You know what, Kim? I've spoken to so many people.
Oh, okay.
And it's great. I mean, you connected me with all these people that I don't remember if I spoke to who.
He's in Michigan, and he's starting the new version of primary care and like an urgent care.
Yeah, I think I
of
did speak to them. Yes, yes. And actually next week I am on a board with Cooperative. I think it was, I forgot the name of the doctor, but she's starting an initiative that basically focuses on telehealth and allowing doctors to form groups. And there's so many things that are happening out there now in reaction to the large medical groups and trying to get the doctors out of these groups and setting up options and giving us options. I mean, a big problem is right now is the at-will contracts, and then we can't. What's the word? We can't stay in the same area. There's a
non-compete.
Non-compete. So the non-compete, what happens is you have an at-will contract and you have a non-compete area. So if you complain that you're not happy, you're not able to take care of patients properly, there's too much work, too much documentation, they fire you. And because you have an at-will contract, so you're at their will. So they can fire you with almost anything, and they can give you, like, I think 2-week or 4-week notice, depending on the contract. And then you actually have to move because of the non-compete. So you got to remove your family. So the doctors are afraid now to complain because they get fired and then they have to move. Now imagine you have young kids in middle school or high school, and you just have to leave. And this is your community that you've been in practice. Part of the greatest thing about primary care is you become active, a big part of the community. And now you have to actually move. So I know there's a lot of things about the non-compete. The federal government is looking at it, and hopefully they'll get rid of it. The non-compete is horrible. It takes away all of your control. And the at-will contracts, we went to medical school forever, and now we have an at-will contract that we can get fired for almost any. They don't even have to give a cause. You can get fired for no cause. There's total control over the doctors. That's why the doctors have to leave. And I really think that doctors need to form a union or something to get the control back, because the answer is not working for these large groups that just care about the money and turning out as much patients as possible. And then they want you to order all these tests and stuff. And then another thing is there's these quality measures. So you are told not to do extra CAT scans because you're paid by the cost. And that's putting a barrier between the patient and you, because you might want to do the CAT scan, but it's a disincentive to do the test because it's gonna cost you money. It's totally wrong. The incentives are totally wrong. And it's just really very difficult.
Yeah, no, thank you for shedding light on these things, and you're 100% correct that the loss of autonomy for physicians is really a huge issue. And then all the metrics, right? It's
Right.
not the things that really should be mattering, the things that they're measured on 100%.
Right.
Geoff, would you like to speak to what you've been doing in your work and maybe some successes you've seen as you work with healthcare organizations?
Yeah, so I think a lot of it around supporting physician well-being and engagement. There's a couple of things that I've been evangelizing to healthcare groups, and it's difficult because it's not the way we've always done it. Is looking at engagement of physicians in a completely different way. What we're learning in healthcare is top-down leadership doesn't work. It's disengaging to caregivers. So I've really found two things that I've been talking to healthcare organizations about to engage their caregivers and their physicians, their nurses. And the two things, number one, research shows that if people feel part of a collaborative team, they are 2 times more likely to be engaged in their work. And Geoff, I know you'll appreciate this. So the part of the team is the first thing. We need to bring back human connection. We need to bring back collaboration over isolation. And make people part of a collaborative team. In Paul Dechant's book that I just read, Preventing Physician Burnout, one of the statistics he gave, and Geoff, you just alluded to this, physicians spend twice as much time with their nose in their EHR than one-on-one with their patients. And the negative effect that has on joy in work, engagement, is huge because it makes physicians feel isolated. It makes physicians feel alone. We lose the human connection of the team dynamic because now most communication is electronic and we're replacing interpersonal relationships. So the first thing I try to get across to healthcare organizations is we have to start looking at engagement bottom up versus top down. When we look at it top down, we have too much information and nothing actionable. But when we measure it team by team, and in healthcare, teams are dynamic. There's environmental services, working with food service, working with social workers, doctors, nurses, all together to provide a care experience. So when we see and we measure where our pockets of brilliance are inside a healthcare system, team by team in bite-sized amounts, then we have something actionable because we just try to figure out how do we make more teams like our best teams? How do we model our best team leaders? So bringing back the interpersonal relationships and lose the isolation and the feeling of alone for physicians is paramount to looking at it completely different. And the second, and I'm sure Geoff will agree with this as well, the second thing I preach is doctors need a seat at the table. Please, healthcare administrators, please, if you're listening to one statement in this podcast, please engage the front lines in your problem solving. Okay. I have been a part of more executive meetings in healthcare organizations with products, services, programs for clinicians, for nurses. And I look around and there's not one of them there. And what that leads to in a healthcare organization is a lack of trust between administration and caregiver. Top-down leadership doesn't work. It's brings disengagement. But when you give them a seat at the table to help problem solve, the people that have the problems aren't involved in the problem solving, which doesn't make any sense. But when you do give them that seat at the table, they feel heard, they feel valued. You correct that lack of trust. I say it away, engage the front lines in your problem solving. Second, trust. That engagement of the front lines leads to trust. Then the trust leads to engagement. So it's engage, trust, engage. And it's just something that in healthcare organizations are at the forefront of clinical innovation, yet they lag 25 years plus behind the private sector and people strategy.
I think your points are extremely well taken. Years ago, we used to have morning report. Now, morning report didn't just include the doctors, it included the nurses and the secretaries, the whole team. The pharmacist was there, whatever, everybody was there. And it doesn't need to be very long, 15, 20 minutes, a half an hour. You discuss every patient before the patients come in. And this way you give out the jobs to everybody and everybody can bring in the input. Morning report is amazingly effective and it should be continued. The second thing you said is that doctors need to be on these meetings. Absolutely. But the problem is that the administrators don't pay the doctors to come to these meetings. So what they're doing is they're actually taking they're taking their money away because they could be seeing patients and generating income. But it's very, very important that to get the doctors to want to show up, you have to actually pay them. You have to give them RVUs or something for an administrative time. Because why would I show up if I don't get paid? And you know, it's very important because you're taking away my income. So I would say, and another thing is the doctors on these committees have to be practicing doctors. They can't be doctors that have become bureaucrats because a lot of the doctors that become bureaucrats are drinking the Kool-Aid of the bureaucracy. And their incentive is to take care of their bureaucracy or their hospital or whatever. And they don't have the incentive to take care of the patient, the practicing doctors. So they become another bureaucrat. So you really have to have practicing physicians or even nurse practitioners or nurses, people that are actually seeing the patients, not a doctor that's a bureaucrat. Because these bureaucrats have, doctor bureaucrats, incentives are different than the practicing doctors. Because they get paid by taking care of their system, not the, but I think your points are well taken. Representation, you see, what the worst thing you can have is responsibility without representation. And that's what doctors have right now. They have total responsibility for everything, but they don't have representation at the meetings. So that's really important. And I also would stress morning report to include the whole team because the nurses have they look at different things and they know these patients really well. And that sometimes the patients might tell the nurse something that they don't tell us. Maybe they have a little more comfort measures and you know they may spend a little more time. So the nursing input is very, very important. And so is important in the front desk because they're on the phone talking to them and they get some cues that we might not get. So we have to use our whole staff, the whole team. Everybody has input and everybody is helpful. Top down doesn't work. Absolutely.
So
And everyone plays a role.
Yeah,
Everyone plays a role because, you know, I watched firsthand. I've spent 25 plus years in employee engagement, employee experience, and with 10 of that in healthcare specific, but it wasn't until my wife's battle with cancer that I really looked at things through the patient's eyes. And until I really even understood my own work, you know, because I watched firsthand her hang on every word and instruction of the doctor that made eye contact. And I saw her coincidentally tune out the nurse that was just checking the box that day.
Right.
And when you see it through those eyes, you realize that the team dynamic in healthcare is quite interesting because they're not teams that tree up to a traditional org chart. You know, my wife had a food service employee that sung to her every time she brought her lunch as she's being prepped for a bone marrow transplant. I walked into her room one day and said, "What?" She was crying. And I said, "Why are you crying?" She goes, "Because Gloria didn't bring me my lunch today." Gloria sings to me when she brings me my lunch.
Yeah, that's all that stuff. And Gloria is important. And you always should take a Gloria's input because Gloria can tell you stuff. So you really have not only include them, but you have to listen to them because they bring stuff. The front desk frequently brings stuff that I wouldn't have thought about. They're helpful. They have to be, the team has to be included and you have to listen to them. They have to be heard, right? That's what you said. They have to be heard because they're bringing good stuff to the team. Absolutely. Everything you said was absolutely perfect.
So Dr. Geoff, now that you've retired from clinical work, what are you doing these days along with your podcast?
Talk to, because of you, Kim, you've introduced me to all these wonderful, incredible, young entrepreneurial doctors that understand all the issues and they're trying to form different companies to support the doctors at different levels. And I've been asked to be on a couple of the boards, which is fantastic. I know they have a board meeting next week with one of the doctors. I just can't keep them all straight at the time. You know, the memory is not as much as good as it used to be. And that's why I retired. But it's just with help, Kim, you're like the center of this whole thing. And there's folks all over the place and little centers all over the place. But you're like the head of this. I mean, it's really amazing what you've done to really reach out to doctors and bring them together. I just want to give you a little round of applause.
Well, thank you. I feel like I'm about to cry because other doctors have said that. They've called me like their central leader or the hub. And it's
Right.
just, I didn't plan on doing any of this and it just happens. And somehow when I talk to a doctor, I seem to know who they'd like to be connected with. And then beautiful things are happening. I just published an episode yesterday with Dr. Frances May Harden, an ENT surgeon in Nashville, and Dr. Beatrice Olson, an endocrinologist here in Middlebury, and now they're collaborating. And it's just it's beautiful. It really is.
I mean,
So
your energy and your interest has been amazing, and I know you're doing this like 24/7, and fantastic.
but you know, when you have a purpose, right, and then you can't not do it.
Well, keep going.
Oh, that's what they tell me too. Yeah, keep going. I will because it fills my heart every, you know, the gratitude from doctors just fills my heart every day as well. So thank you. Geoff, I was wondering what suggestions you'd have for patients who would like to support their doctors, and I think you might have a story to share in relation to that.
Yeah, and I think a lot of this talks about kind of what Dr. Geoff has said about some of the frustrations of practice for these physicians. They're dealing with things that aren't patient facing, that aren't why they chose healing, why they chose, you know, their purpose. And I think as patients, I think we need to understand a little bit more of what they're going through, understanding that they weren't 45 minutes late to your appointment because of them. They were 45 minutes late to your appointment because of systematic failures all over the place that are causing this. So I think it's really important for patients to be what they want their doctor to be, more compassionate, more empathetic, more understanding. And when you look at suicide rate, 40%, male doctors, 40% more than the general population. Okay. And you think that's bad. Female doctors, 130% more than the general population.
Wow.
Okay. So when you look at that, that shows you that systematic failures are causing that disconnection to purpose and a disconnection to why they originally chose healing. And so I think sometimes we can put it on ourselves to help reconnect doctors and caregivers to why they chose to do this. And I was at a doctor's appointment recently with my wife, and before she was diagnosed with cancer, she went 6 months being undiagnosed. Her oncologist knew something was wrong, but they couldn't put their finger on it. And it wasn't until she had a small kidney issue that we went to a different system in Connecticut, to a nephrologist. And he looked at one of her tests and he said, "Can I have the number of your oncologist? I know what's wrong." And one day later, she was diagnosed with multiple myeloma. So we finally had someone we were fighting versus just this invisible thing. And she's been in remission for over 3 years. But we went to that doctor, that nephrologist, the other day just for a normal checkup, nothing big. And as my wife walked out of the office at the end of the appointment, she turned around and she looked at him and she said, "Thank you for saving my life." And our doctor started to tear.
Mhm. Yeah,
And
we're
he just looked at
human.
her
We're
and
human too,
he said, "You are the reason I do this."
Mm.
So when you think about
I have to call you back. Bye.
connection to purpose, it's important to help our doctors reconnect. I mean, we have the world's largest generation is retiring and entering the healthcare system at huge rates, needing healthcare, and the system is pushing our doctors and nurses out of it. So give some thought to just helping these people reconnect to why they chose healing.
I can also give you some mechanical advice. Sorry about that. When you see a doctor, always bring your medication list in. And if you have multiple doctors, bring all the lists in. And you can even bring the pills in, because the medical list is frequently non-accurate, and that's probably the most important thing. Also, bring your tests. If you got a mammogram or a CAT scan, or bring every information that you have, because nowadays you're on portals, right? So go to your portals and print out all the stuff, all the tests. Print out all the visits, because as doctors, we might be on different computer systems. We might have accurate information right away. So go to your portals, print it all out. Go to your pharmacy and get the lists. The lists are really important. And go to the pharmacies and get your vaccination lists, because we don't have access to that. So medicines and vaccinations are really important, and we might not have all that information. If you can bring that to the doctor, that could save a lot of time. And it's easy. Go to your portal, go to your pharmacy website, and just print it all out. And then, yes, and I do understand that if we're late, we don't do it on purpose. We have bad days too.
Well, thank you. That brings what you both said brings three things to mind. And one is, speaking to patients too, is now I have a certain mindset when I go to my appointments, knowing that they might be late and that they're doing the best they can and they don't want to be running late either. And I have one doctor, I've even waited up to 2 hours for him, but now I know not to plan anything after. And he's an amazing doctor, and I'll wait 2 hours for him. He's worth it, right? It's not his fault.
Bring a
And,
book.
huh?
Bring a book and read a book.
Yeah, exactly. Actually, I do. I have lots of books written by doctors that they're sending me, so I have a whole stack. And then another one, speaking to, I think, what Javid said, is there are obstacles to physician seeking support, and that's another big problem. And I'm actually now a volunteer, an ambassador for the Lorna Breen Heroes Foundation. And one, the things they're working on is to eliminate the barriers to physicians seeking mental health support. And another thing I do through these episodes is doctors share stories, and every time a doctor shares a story, another doctor feels less alone. And when they hear that they're not the only one who's been through this or has felt this, that really helps as well. And also, as far as what Dr. Geoff, you were speaking to, is when I switch. So now we have the same primary care doctor, right? And I'm actually seeing him tomorrow, so I will tell him about this chat.
Tell him I said hi.
Yeah, okay, I will. And when I first met him 3 summers ago, it was amidst a lot of complicated issues of my own. So I typed up a medical summary for him, and he came in and he thanked me and he said it was so helpful. And now, since things have been so complicated over the past 4 years. Oh my gosh, like he's, he figured everything out. He's amazing. But what I do is I keep it up to date, mainly for him, because also my information is in 3 different healths. My breast oncologist is in Westchester. Most of my doctors are here, with the one system in Connecticut, and then my medical oncologist is at Yale. So it's my responsibility, really, it ends up being, to coordinate that and make sure all my doctors have the information that they need. So I update it every 6 months, when I'm about to see him. So I just sent it to him the other night, and then he can upload it so then my other doctors can see it. So,
Huge.
yeah, and my doctors have thanked me for doing that. So, well, I'm sorry that we have to wind this down, because this has been an amazing conversation, and I'm actually glad that I was able to connect the 2 of you with each other, because I actually spoke to you one after the other. It was like a month or so ago, and I was like, oh, these guys would like to know each other. So,
Kim,
I'm
could I say
glad.
one last thing?
Yep,
Yeah,
I
I
was
know
just
we're
going
running
to say, I
short on
wanted
time.
to ask you, but
Yeah.
I did want to ask you how listeners can get in touch with you, and so you could mention your podcast. So go right ahead.
Yeah. So I didn't want to feel left out. We talked about, this, we're on your podcast. We talked about Geoff's podcast. I'm launching one. I was approached by a major podcast network, and we're launching in the first week of July, and it's called Moments of Experience, named after my 14-year-old beagle, Mo. Because when we were going through a very tough time of tragic loss and life and death, illness, Mo gave us some real moments of human connection, of experience. So I'm bringing on leaders across employee, patient, caregiver, and just human experience.
What's it called again? Mo
Mo-ments of experience. And what it is I'm talking
Mo-ments of experience.
and I'm talking to all of these amazing innovators throughout the globe about their moment that either connected them to their true calling, their true purpose, or reconnected them. So we're telling stories of, with so much negativity in healthcare, we're telling stories of what does fill our cup and what did get us on the path to do what we love to do.
If you can send Kim a link, and I will definitely join it and also subscribe, and then I'll.
Yeah, it hasn't launched yet. It'll be, a trailer is coming out in the next couple days, and it'll be on my LinkedIn.
Okay, awesome. So what I'll have both you guys do is send me any links that you want me to put in the show notes, and for YouTube and on LinkedIn, and I'll share any links that you want. And so how I always end is I say, to move the needle in healthcare, we all need to raise our voices, and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
You're amazing, Kim. Thank you.
Thank you, Kim.
Thank you both.
Bye-bye.